So acid reflux is one component of GERD, gastroesophageal reflux disease, where acid can splash up and cause discomfort and pain and difficulty swallowing. We think of primary symptoms associated with simply heartburn, and then secondary symptoms where people have sometimes trouble swallowing, even sinus pain and headaches can be due to gastroesophageal reflux disease. If you were recently diagnosed with gastroesophageal reflux disease or GERD, treatment options include making adjustments to your diet, making adjustments to behavior, and often taking medicines to relieve the acid and raise the pH and make the stomach acid less toxic or less bothersome in the esophagus. What I tell new patients who are diagnosed with GERD is that they must make adjustments to their diet, cutting back the coffee, chocolate, alcohol, tomatoes, onions, citrus. Mint sometimes can cause problems. Make some adjustments in their behavior, eating earlier at night, going to bed always with an empty stomach. Elevating the head of the bed at night can sometimes help and lead to less acid. And then sometimes there's a role for medicine to help the acid-base relationship in the stomach and lessen the acid so that patients are more comfortable. Patients come to me with all kinds of symptoms of discomfort. Sometimes waking up at night with heartburn or discomfort, sometimes difficulty swallowing, sometimes weight loss without even trying, and they all fall into the category of gastroesophageal reflux and need treatment. It's important for people with GERD symptoms to see their doctor because acid can splash up and cause damage to the bottom of the esophagus. There's a common condition called Barrett's esophagus, which is a precancerous condition, and we worry about gastroesophageal reflux disease in an untreated form where there's no changes to diet and behavior, where there's no medicines on boards over time leading to cancerous concerns. Clearly, we've come to a place where there are great treatments for this problem, that no one should suffer from acid reflux. Sometimes you have to give up your favorite cup of coffee or your favorite chocolate or making some adjustments that you're not so fond of, but along with dietary adjustments, some behavioral things, eating earlier, watching the portion size, not skipping lunch and then eating a very large dinner, you can feel well and you can have long-term health. Some people with a lot of reflux have minimal symptoms, and some people with a little bit of reflux seem to have a lot of symptoms. So we do certain tests like an upper endoscopy, where we slide a camera down and visualize the inside of the esophagus and see what the anatomy is all about, and really come up with really substantial concrete recommendations to help eliminate the problem. Some patients believe that it's only a problem of bad breath. They feel the acid reflux, they may not feel the sharp pain, and they take certain candies, certain sweets, certain mint gum as a way to make themselves feel better and have better breath. But in fact, we know that, that certain chocolates and candies can lower one's esophageal reflux tone and allow for more reflux. So it's a problem that some people are treating short term, but creating more damage long term. So it's best to see your doctor and go over the treatment options that are available.